Welcome back. We all know this is a really anxious time for a lot of people. Local doctors really noticing it too, and many are seeing a spike in the number of people seeking mental health care. But you may be wondering how to go about that. How do you find the right person for you? Joining me live is Dr. Danielle Henderson. She is a clinical psychologist at IU Health. Doctors, thank you so much for joining us this morning.
Thank you for having me.
Absolutely. This is so important right now. We are hearing more and more the mental aspect of what is happening around our country for people. What do you think you want people to know as far as what's the first step if somebody thinks that they want to talk to somebody or trying to find somebody, a professional to help them?
Yes, I think one of the biggest things is reducing that stigma that some of us have or that our society has about mental health and about seeking mental health care, and recognizing that if you feel like you're in need of help, that's important for you to recognize. And there's quality help available. So I always encourage people to talk to their primary care physician or any other medical providers with whom they work closely about what's going on, and maybe mental health professionals that person might know. Check with their insurance to see mental health professionals in their area who would be covered by their insurance. And then also, as they feel comfortable, I encourage people to talk to friends and family and ask them for recommendations. You'd be surprised about the people in your circle who've sought mental health treatment and benefited from that.
Absolutely, and I think too for a lot of people it's finding the right person. We're all so different, and just because you maybe talk with one person, it doesn't mean that another person is not going to even maybe fit and mesh with you better. How do you go about finding the right person for you, do you think?
Sure. Well, I think a couple things. One, thinking about the type of person with whom you might feel comfortable. So are there certain characteristics that are important to you? For example, age, veteran status, years of service or work in the profession, race, ethnicity, thinking about those things, or sex, gender, thinking about, are those things important to you? And then also thinking about the type of care that you're needed. Has that person received training in a specific intervention that could be of help for you? Or is that person maybe an expert in treating whatever diagnosis that you have? Those are things to keep in mind as well. And I tell my patients it's a relationship just like any other. Yeah. And so there's that comfort is going to be important as well.
I only have about 30 seconds left, but I do know that you are doing, the in-person and you're doing virtual. How do you feel like that is working out, that if somebody maybe doesn't feel like they can physically go there, having that virtual relationship sometimes is just as good?
Yes, you will still get the same quality care. I will say, with technology, sometimes we have glitches. Another thing to consider that with virtual is that you sometimes do miss those nonverbal communicators. And then if you're at home, it might be uncomfortable to talk about really personal things in the home environment where other people are around.
Very good point.
Yeah,
so you have the option, but you are there in person too. Doctor, thank you so much. And we're hoping that more people will reach out and feel like they can get help when they need it. Appreciate you.
Thank you. Thank you.